are?
Susie.
Susie, okay. And you want to make sure, now you don't want to say and you are, but you do want to make sure that you're with the right patient, you know what I'm saying? So, hi, I'm Dr. Cho, and I'm here, I'm going to be examining your hips to see what may be the cause of what's bothering you. Okay? So it's going to involve me having to look at, move, and feel them. Is that going to be okay with you? Mm-hmm. Okay, cool. All right, so that's what you want to get that permission up front, get it out of the way, and then you don't have to always get permission over and over and over. I've already asked her, is it okay? I'm going to be looking at, I'm going to be moving them, I'm going to be feeling them to see what's going on. The patient understands what I'm doing. Okay? So the first thing we're going to do is our what?
History.
No, we've already done that.
Inspection.
This is examination.
I just met you. You know nothing about me.
No, we've already done the history. I'm going to be examining you today.
Oh, okay. Yeah. Why'd you introduce yourself again? Crazy.
Well, I may be the exam doctor, right? Have you ever heard of that?
True.
Yeah.
Most patients are not this difficult.
Most classes are not this difficult. They are fun though, but anyway, so does everybody understands that? So what I'm going to do is I'm going to start with my visual. So I'm going to say to the patient, okay, I'm going to stand here. I don't want to have my back. I don't want to have my back to you, but just so you can see what I'm doing. So I'm going to say, okay, very good. Would you just stand with your hands at your side? And can you take a quarter of a turn to your right, please? Oh, no, a quarter.
Face that wall.
You're going to face that wall.
Oh. I thought you meant a quarter of that turn.
Me too. I was with you there.
All right.
That's it.
Just
That's
say
it.
face the blue wall.
And you know, that's a good thing. Sometimes patients, they don't get it. So you could just say, maybe I should have said that. Would you turn and face that wall?
Okay, I can do that.
And so that's what we're going to, and I'm going to have you turn and face the one more quarter turn. Thank you. And then one more to the right. There you go. And then back towards me. Thank you very much. And I'm going to ask you, would you turn and walk away from me about 6-7 steps, please? Right? And then you're going to have the patients. That's great. Thank you. And turn around and come back. So here's what we're looking for. And you guys are going to tell me this. You don't say this to the patient, but you'll be telling the examiner, whether it's Dr. Brewster or myself. You're going to be looking for the 6 S's, right? Do you remember me telling you? You're going to be looking for size, shape, symmetry, swelling, scarring, subluxation, all these different things. Now, if I was really doing this examination on this patient, you want to see as much of the patient as you can. So definitely you'd want to have at least examination shorts on them in case you're seeing anything down below at the knees or the ankles, whatever that may be affecting them. You want to have a gown on, or sometimes what they'll do is they'll use something up top so that you can see the spine. Because when you're looking at the patient and they're moving, you could look for what? Hip changes, you can look for gluteal changes, you can look for evidences of genuvalgum because of coxavera, coxavalga. You can look for toe pointing, you can look for scoliosis. All these different things you're going to be looking for when you're examining your patient, okay? So you're just going to keep that in mind. And as we go through other parts, you'll say, oh yeah, we've got to look at that and this. Okay, so that's what we've done. We've done our physical examination, our visual examination. The next thing we're going to do in this is we want to see, is there any evidence of any atrophy, maybe in the thigh muscles, the quads, etc. So we're going to do we're going to measure the circumference of the widest part of the thigh. And so the way you're going to do that, on here you're either going to have the metric system or you're going to have the standard system. I don't care which one you do, but make sure you do the same one from side to side, right? And when you do it, I want you to remember what you've done. So you could even say the number while you're doing it, okay? So I'm going to have you move forward just a little bit for me, thank you. And you're going to do it from the side for obvious reasons. We're going to go just like this. We're going to go down below. And then when we come up, we'll be here. And when we measure, you want to be what? How do we want to measure, folks? You want to measure the widest part parallel to the floor. This would not be acceptable. Has everybody got that? So you'll do this at this level. You're going to make your measurement. And I'm going to have you, could you turn and face the wall behind you? Thank you very much. Then we'll do the same process again. Find the widest part. Do your best to do that. And then come up and make your measurement again. Does everybody have that? Very good. Okay. The next part of our examination is going to be lying on your back. Okay, so I'm gonna have you, if you would, lay down here. Now here, before the patient lies down, I'm gonna be making sure, now in the test, she's gonna have her own headrest paper, right? She's gonna have her own napkin or whatever, but you as the doctor needs to make sure she uses it, because if you don't, I'm taking off a point. If you don't introduce yourself to the patient correctly, I'm gonna take off a point. It not only mentions in the examination, but in your dealing with the patient, you're treating them with respect, courtesy, and so on. Has everybody got that? Okay, so I'm gonna have you lay on your back here for a minute, please. Okay, so then we're gonna go to our supine examination. First thing we want to do with our supine examination is a temperature and dermatome. I always say the best thing to do in a football game is make a touchdown right off the bat. So anyway, so in your supine and prone examination, TD, we're going to do temperature and dermatome. Okay, has everybody got that? If that helps you to remember the order, that's great. So, temperature, we definitely want to check over the bursa, and you always want to use the back of your hand because that's where your skin is the thinnest and you get a better feel for it. So it's just kind of quick and simple. Okay, it's about all you need to do. With dermatomes, you're going to take out your trusty reflex hammer and you're going to say, hi, I'm going to run this over your skin and it's going to feel like this, okay? And I'm going to do a comparison side to side. And I'll be asking you questions as we go. So I'm going to have you close your eyes when we do this. You always want to have your patient close their eyes. Now when we're doing the dermatomes here, we're just going to start at 12, and that's going to be about the iliac crest. So we're going to do, does this feel like this? Does this feel like this? And then of course we're going to come this way. Okay? So I'm going to come here. Does this feel like this? Mm-hmm. And does this feel like this? Mm-hmm. And does this feel like this? Okay. Now, along with the dermatomes, we also want to check the peripheral sensory nerves, right? Hopefully you guys remember. Peripheral sensory nerve coming down this way. The first one is what? Does this feel like this? Mm-hmm. And that is what? The anterior femoral cutaneous. Very good. Over here, does this feel like this? What is that? Very good. And does this feel like this? Which one is that? Operator? Okay, very good. So we've done our temperature and our dermatome. So in conjunction with the dermatome, we're checking for sensory, because as you know, sensory does not always follow the dermatome, so we want to figure that out. And so, yes, you need to remember all that little bit of information that we've done in Ortho and R2. I know I warned you back then, but you need to know just because you need to know. Okay? Okay, next thing we're going to do is it bony palpation? Okay. So, we're going to do our iliac crest, our ASIS, our AIIS. We're going to come across to the pubic bone. We're going to come over here to the greater trochanters, and then you can just come down the femur. Okay, has everybody got that? Okay?
Yeah.
All right.
My muscle is tender right there. I don't know why.
Well, yeah, and that's, you find all kinds of things. And you can always say to your patient, if anything hurts or causes you discomfort while I'm doing this, please inform me of that. That's okay. Okay, the next thing we're going to do is our soft tissue. In our soft tissue, we want to look for things like lymph nodes. We want to look for like bursa. We want to look for ligaments. We want to look at muscles and things like that. Okay, so we'll do the inguinal lymph nodes, and you're going to do hand on hand, and you do not reach across when you do this. You only examine the side that you're doing. So you're going to come down like this, just moving around just in this direction here. Then you're going to move to the other side. Any type of issues with the lymph nodes, right? Has everybody got that? You're going to compress over the bursa here. Which bursa is this, and which bursa is this? Does anybody remember? The iliopectineal and trochanter. Okay, so then you're going to bursa. One of the chief tendons that you're going to look at here comes from the ASIS down to the pubic bone, and that's what? No. The inguinal ligament. Oh. The inguinal ligament. Okay, and that gets involved with what? Anybody remember? Neuralgia paresthetica. That's where you can get entrapment. And one of the treatments for that is just some cross-friction massage over top of that ligament. Next, you want to do the muscles, the chief muscles we want to do. Remember, we were talking about them because people problems. The psoas muscle gets real tight. So you'll just come down here, and you'll palpate right down through here. And of course, palpate on the other side. And I also think it's a good idea to go back to the ASIS and what attaches there. Sartorius and then the AIIS. So the sartorius will come down this way, your rectus femoris this way. I don't care how far you follow the muscle necessarily, but I want you to definitely look at the origins of those muscles. Okay, sometimes it can be very clear in that area. Okay, has everybody got that? But if the patient says to me, hey, you know, this is tender like she did, I'd probably follow that muscle further, right? And just try to isolate and see what's going on. All right, so after we've done that examination, we're gonna do our ranges of motion, our active, passive, and resisted ranges of motion. Now, when your patient's doing these, you wanna make sure that they're doing them and not, and that they're stable on the table, and so that you're getting a good motion on this. I'm not interested in numbers on this. To be honest with you, I don't know the numbers. I've looked at them 500 times, but what I am looking for is what? Right, I wanna make sure that the patient is kind of even on from side to side. So the first thing we're going to have our patient do is I'm going to have you, if you would, flex your hip, thigh all the way up to your chest if you can. That, no. Not helping. Just like that. Very good. Thank you. And you can put it back down. And can you bring the other one up? Very good. And take it back down. Did anybody notice a difference on that? This one came up further, probably because she stressed it with her hand. But you want to make a note. If this patient was in exam shorts, she probably would have had a better range of motion. You know, jeans, tighter pants on, that's not really what you want to do. Okay? Okay, so next what I'm going to have you do, if you would please, would you bring your knee up to about here? There you go. And now I'm going to have you, can you turn your foot all the way that direction? No, I'm sorry. I'm going to have you do this as far as you can. Very good, thank you very much. And see, I'm not inhibiting her, I'm just guiding her. Can you turn your foot out the other way? Very good, thank you very much, and you can put that back down. Can you bring the other one up, please? And again, take this one this way, very good. And in the other direction. Thank you very much. So that's our what, ranges of motion? Internal and external. When the patient's foot is going laterally, that's internal, because we're looking at the hip. We're not so much looking at the foot, we're trying to understand what's going on at the hip joint, okay? Then the next thing I'm gonna have her do, I'm gonna stabilize here. Can you take this leg and move it as far out to the side as you can for me, please? Very good. And then can you take it as far over the other direction as you, no, I'm sorry. The same one, all the way over. There you go, thank you. Now, see, this isn't very good here. Did you see what happened? So, what do I need to do as the doctor? I need to change my stabilization. Okay, can you try that again for us, please? Very good, right? And then I'm gonna move around to the other side. And I'm gonna say, can you take this one all the way out for me, please? Very good, thank you. And then can you take it all the way over to the other side? Very good, thank you. And you stand at the head of the table when you're doing these for obvious reasons, okay? After we've done the active, we're gonna do what? Passive. Now, when you guys are doing the passive, I don't want you to just go like this, okay, because passive is supposed to be what? That's relative to active, it's supposed to be what? A greater range of motion, right? So you're gonna do your ranges of motion like this. Okay, make sure you get a full range of motion on that. We're gonna bring the patient's leg up like this. I'm going to turn this all the way up this way. I'm gonna turn this all the way in this way, right? And you're making notes of this as you're going through. If you want to do more than one at a time, that's fine. Don't do the whole examination because I doubt if you'll remember it. So this one here, I'm gonna come here. Now if I wanted to go and do internal rotation on the other side, I can, but I think it's okay to do both internal and external rotation at this point. Has everybody got that? Now remember, you want to keep it up here at 90 when you're doing that. Then you're going to do this. Okay, we're going to come here. Okay, and I'm going to do this. Okay. Stabilize this, please. Thank you very much. Concentrating on that hip joint. And we're done. Okay. Everybody understand that? That's our what? That's our passive. can you raise your, I'm gonna hold, resist here, would you raise this off the table for me? Good, thank you very much, in here. Very good, thank you. And can you bring your leg back up for me, please? Okay, now can you turn your ankle, push it against my hand? Very good, thank you. And try the other one. Good, thank you very much. And bring the other one, oh, I'm sorry. Push up. Okay, bring this back up. I may have done that twice. Push in, okay, and push out. Very good. And I'm gonna have you just push your ankle out toward, your whole leg out towards me. There you go. And in, very good. And in with this one. Good. And out with that one. Okay, so you've got your active, passive, resistive range of motion. That's all, a lot of it is neurological, orthopedic. You know, you're looking for range of motion, you're looking for strength, et cetera, et cetera. That's why it's important you try to remember, like maybe what nerve roots might be involved, maybe what nerves, of course, could be involved, what muscles are involved, and so on. So it's all part of your examination. If you forget, go look it up, make a note. Person is unable to abduct or internally rotated, et cetera.
You ask questions or anything?
I'll just probably make sure you're doing it correctly. I will ask questions on your written test. Okay, there are two 25-point written tests, one midterm and one final. Let me think of any type of questions I might ask you. I'll think about that. And I just pretty much want to make sure you know what you're doing. I don't know, I'll think about that, because I don't want to spring that on you. Oh, I don't want to guarantee I'm not going to ask you any questions, but just have an understanding of what you're doing, not just emotions, right? What we're trying to achieve here. So, but I won't beat you up to death, beat you to death with whatever. I know I won't do that. Okay, okay, the next thing we're going to do, we're going to do our measured and apparent leg length. The apparent leg length is the one that comes from the umbilicus down to the medial malleole. Okay, so could you show me right where your navel is, please? Very good. I'm going to just set this right in here. And again, whichever side you want to use is fine. What is it? 5 to 15 millimeters, I think, is normal, considered an acceptable range, or 3 to up to 3/5 of an inch, I think.
Did you say apparent?
Apparent,
Okay.
yeah, but for either one of these leg lengths, okay? But the first one is apparent, and the way I remember, can you show me your belly button again? Thank you. Well, the way I remember that is, this looks like an A, right? So that's our apparent, right? Our true comes from where? And you can do it in millimeters, you can do it, if you're doing it in millimeters, then you should have 5 to 15 millimeters difference is considered an acceptable range.
Such way from ASIs to medium?
Yes. Okay, that's your true leg length, apparent and true leg length. So the last thing we're going to do is we're going to do a deep tendon reflex of our hamstrings. You've heard about that. I don't know if you've ever done it. Just the way to do that is just to have the patient relax their leg against you here, just like this. Come up. And for those of you in the cheap seats, if you want to move your seats, I'm going to grab onto the semimembranosus, semitendinosus tendon here, and I'm going to look for any type of reflex that takes place within the thigh muscle.
She doesn't even get one.
Okay, everybody got that? So that's your full examination in the supine position.